Hi, welcome to The Vitals, Mount Sinai Health System's newest video podcast. I'm your host, Leslie Schlachter, a neurosurgery physician assistant. Today, I'm grateful for the opportunity to have an intimate one-on-one interview with Dr. Dean Charney, Dean of the Icahn School of Medicine at Mount Sinai Health System. Dean Denis Charney is a psychiatrist, researcher, scientist, author, leader, and has devoted his life to the neurobiology and treatment of mood and anxiety disorders. He's not only committed to researching and teaching resilience, but he's experienced it himself in the most personal way. He went to medical school at Penn State, completed his residency at Yale, and fellowship at the Connecticut Medical Health Center. Prior to coming to Mount Sinai, he led the Mood and Anxiety Research Program at the National Institute of Mental Health, and he was on the faculty at the Department of Psychiatry at Yale. He was elected to the National Institute of Medicine in 2000, and then Dr. Charney became the Dean of Research at Mount Sinai School of Medicine in 2004, later becoming the Dean of Academic and Scientific Affairs. Then in 2007, he became the Dean of the Icahn School of Medicine at Mount Sinai. He has 5 children, 9 grandchildren, and is known for his love of sports and weightlifting. I'm thrilled to have him here. Thank you so much for coming today.
Happy to be here.
Yeah. Do you remember the first time that we met?
I do, if we're thinking about the same thing.
Okay. Do you want to tell the story how we met?
Well, we're at one of the Crystal Party.
That actually wasn't the first time that we met.
Oh.
We met in the Annenberg lobby during a basketball shooting contest.
Okay.
And you came up to me and you asked me who I was, and I said, "Who are you?"
Okay.
And we kind of got to talking then. I think you liked that I was tall and played basketball, and so I think you first found me then, but then at the Crystal Party.
So at the Crystal Party, I said to you, did you play basketball? And you said, I won't say the exact language, you would kick my butt.
Yeah.
I went back to my table and said, she said she was going to kick my butt. Nobody's ever said that to me before.
I probably believed it back then. Right now, I know I definitely couldn't. But
because I played basketball too.
Yeah. I think we both share the love of basketball and weightlifting.
Yes.
Sports is important to us, and so is fitness, right? And Bill Bradley is like one of your heroes? What's the word?
Yes.
Yeah.
In fact, when Bill Bradley played at Princeton, there was a book, a biography is written by him, by John McPhee, called The Sense of Where You Are. I must have read that book 10 times or more.
Yeah, it's like the Bible. You keep getting more out of it.
He was an idol of mine.
Yeah.
And then, of course, he became a Nick.
Yeah. Okay, so we kind of connected over the love of basketball and fitness and healthcare, obviously. So, like in your introduction, you're the dean of the medical school. What does that mean to people who are like, what's a dean?
The dean at Mount Sinai Med School means that I'm responsible for the education of medical students and graduate students, and particularly at Mount Sinai, to educate the best and the brightest who are going to be leaders in science and medicine. I also oversee the research component of our medical school, and there my responsibility is to recruit the best scientists who are committed to making discoveries that change the lives of our patients. And then, of course, we have our faculty practice, which provides great care for the most serious problems.
Being a dean of a medical school, is that something that you thought about when you were practicing as a physician, or is that something that kind of just evolves and fell into your lap?
It fell into my lap. You know, I'm a psychiatrist, neuroscientist, and spent the beginning and up to the middle of my career doing science, making discoveries related to depression and post-traumatic stress disorder, resilience.
Right.
And then I was leaving the National Institute of Mental Health and was looking for another position. And I was offered, this is actually an interesting story. So I was offered the chair of psychiatry at Columbia. And Ken Davis at that point was the CEO of at Mount Sinai, which I didn't know that much about Mount Sinai, but Ken and I were best friends. And so I was going back and forth. Should I become chair of psychiatry at Columbia, which would be kind of an obvious thing, being a psychiatrist, or come to Mount Sinai, where Ken said to me, you would become dean. So I was going back and forth. And one of my daughters is a psychologist. And she said, you have the opportunity to work with your best friend. And I said, you're right.
Yep.
I'm coming to Mount Sinai.
Yeah, because sometimes you just follow your gut, not your head. What do you think are 3 of your strongest characteristics or traits that allowed you to be successful?
I'm passionate, very committed to when I set a goal. And I expect the people around me to be committed, be passionate, and frankly, shoot to be great.
Yeah, I think if you're committed and have passion, there's not much. I mean, you'll figure it out. You'll get it done, right?
But you want to be a key is that I want people around me who want to be great, not just good. In fact, when I first took over deanship back in 2007, I bought a book called Good to Great by Jim Collins, very well-known book. And I bought it for every chair, every leader at Mount Sinai. And I said, you better read it. Because if you're not willing to shoot for greatness, you're in the wrong place.
Yeah. Oh, I couldn't agree more. Let's talk about resilience. You literally wrote a book on resilience. Yeah. And if you've made it a big focus of your work and your research. What prompted your interest in psychiatry and specifically resilience? And how do you define resilience?
It's not it's not difficult to conceive what resilience is. It's the ability to bounce back. When you're faced with a serious obstacle in your life, trauma, disappointment, how do you overcome that? And in many cases, even become stronger. I became interested in resilience with my buddy, my long-term other best friend, Steve Southwick, when we were at the Yale West Haven VA hospital, where I was chief of psychiatry and Steve was overseeing the treatment of post-traumatic stress disorder. And we felt that we could come up with better treatments for PTSD if we could understand resilience. So we decided we're going to study resilient people. And we ended up getting to interview and in many cases becoming friends with people who were resilient.
Right.
And it changed our life, our personal life.
Yeah. Is resilience genetic, or is it a learned behavior, or is it truly only just a direct result of a trauma or a problem?
Resilience is both genetic and can be based on life experiences. You can train yourself to become a more resilient person. In fact, that has been the focus of our research for the last many years. But it is partly genetic, but genes are not destiny. You can train yourself to be a more resilient person. So then when you're faced with the next obstacle in your life, you're prepared.
Would you say that it's more optimism that kind of gives you the groundwork for resilience that maybe you're born with?
It's not just optimism. When Steve and I were doing our work, and we got to know people from many different aspects of life, including POWs from Vietnam, who we really learned a lot from, Navy SEALs, Special Forces in the Army, people who were born with congenital disease, who faced natural disasters, who were unfortunately sexually abused. So people from every different socioeconomic group. Based on meeting those people and learning from them, we came up actually with 10 factors that relate to resilience. Optimism is one, but there are others too that are really important.
It's just a part of it. Do you need humility in order to be resilient?
Not necessarily. I mean, humility is an important trait in general. You need to be optimistic. So if you're too humble, you're maybe not optimistic enough. So I would say optimism is a more important trait than being humble. But of course, being humble is a good thing.
So not everyone can be lucky enough to be optimistic. So what's your advice for those who are resilient? Like, I consider myself a very resilient optimist.
Yeah.
What's your advice for people like me who are forced to live with or work with pessimists or non-resilient people?
Yeah, I don't like being around pessimistic people. But you can there's a form of therapy called cognitive behavioral therapy. And the basis of that therapy, which is used for depression and anxiety problems, is to help people see their world in a more optimistic way. So you can take a pessimist and maybe not make him an optimist, but you can make him less pessimistic, and feel that they can overcome things and prevail. Right. So you can move the needle on people from pessimism to optimism.
How do you feel your physical fitness has played a role in your own strength and resilience?
We were talking about the importance of physical fitness, and that was important to the prisoners of war who were held in Vietnam, who were held in very small cells. And one of the POWs that it was a real role model that when it came to physical fitness was Lou Mayer. And Lou practiced the JFK 12 in the cell, got to the point where he could run 24 hours without stopping. Mm-hmm. And he also told Steve, my buddy, and myself when we were interviewing him, that he could do 61 push-ups. And I thought, I could do more than 61 push-ups. I wasn't that impressed. But then he said,
probably wasn't getting a lot of carbs, so.
No, but one-handed.
Oh,
That's impressive.
That's tough. That's very impressive.
Right. So physical fitness is very important to self-esteem and overcoming the effects of a trauma.
I've gotten to know you really well behind your back as getting ready for this interview. And in one of your interviews, you said, and we're going to get in a moment to your history with violence, but it's important to you that you're tougher than the rest.
Yeah.
Why?
It's important to my self-esteem, that I'm a person that could overcome things, that are difficult, that I meet challenges, head on. So it was important to my self-esteem. And as an athlete, I'm sure you resonate with this. I always felt that I was a very tough competitor. And in fact, there was one story was that there was a coach that I really admired when I was in high school, and he helped me. And then he became the head of Brown University's basketball team, and they won the Ivy League. And I wrote him a note. This is 20 years after he worked with me. And I said, congratulations. And he wrote me back. He said, I remember you were a tough player. He didn't say I was a great player. He said I was a tough player.
You just need grit. That's all you need.
But I took that as a good compliment.
I would too. Yeah. So can you tell us the story about the incident you were shot several years ago? Can you share with us what happened and how that kind of helped you on your own continued journey of resilience?
Yeah. So now it happened at the end of August in 2016. I live in a town called Chappaqua, and there's a deli called Lang's, a deli that is everybody goes to in the town, like Cheers from the old show. And so I live about a mile from Lang's, and so I left the house one morning and went to Lang's, where I got a bagel and coffee, which I always get. And I walked out of the deli, and all of a sudden I heard a loud boom, and I was shot in the right side, upper right side of my body. Mm-hmm. And the first thing, so I turned around to go back into the deli, and it turns out that I was shot on the right side, so I dropped the coffee, but I had a bagel in my left hand, and I never dropped the bagel, even though I was shot. So one of the things we found out, I didn't know it right away, is I was shot by a former Mount Sinai faculty member who we had terminated for scientific misconduct. I didn't really know. But
many years before.
7 years before.
Yeah.
And I didn't really know him, but because I was the dean, I signed the final termination letter. But he obviously became obsessed with me, tracked me down in my hometown, and there was actually evidence that for a period of time before he shot me, he figured out where I lived.
Get to know your schedule. Yeah.
Knew where I lived.
Yeah.
And so he shot me, and then I ended up in the ICU here at Mount Sinai, hospital. Lost half my blood. Now I did take it as a challenge
Right.
because I was studying resilience, but I had never faced something like that. I'm Vietnam era, but I never went to Vietnam because I was in college and grad school. So I did take it as a challenge on how I would recover.
Did you just like pull at your grit and just do your best and be the toughest to go through it? Or did you actively think to yourself, okay, these are the steps of resilience. Let me work on them.
I was going to find out if I was resilient. Right. And I felt that was very important to find that out because I had researched resilience.
Right.
I found out that a lot of things that we identified as the prescription for resilience made a difference for me. Mm-hmm. One, I am an optimistic person, so that helped. Social support is very important from people that really care about you. And I had my family, my friends right away, and the faculty here were very supportive. Now, you mentioned tougher than the rest, so this sounds totally weird, but Bruce Springsteen, who I'm a real fan of, wrote a song called Tougher Than the Rest. And I kept hearing that song when I was in the ICU and I said, I'm going to be tougher than the rest.
Yeah. I mean, a good title, not so much the lyrics maybe, but
you're
good
right,
title.
But the lyrics weren't exactly related to that, but the titles.
Right. So just for like people listening, resilience isn't necessarily how you deal with something while you're going through it. It's how you come out the other side, right? Because it might be, you might feel weak and not up to the challenge in the moment, but really what kind of person do you come out on the other side? And what major differences did you see in yourself, specifically in your personal life and at work, with what that did for you to continue shaping you?
Yeah, so you're right. The first couple days after you've been shot or something else happened to you that was bad, the resilience comes through as a process in your recovery, and in many cases you can come out the other side stronger, and better prepared for what else life is going to bring to you. And in my case, a lot of that happened. When you could have been killed, and I could have been killed because if I didn't turn toward my car coming out, the shotgun blast would have hit me front on, and then I would have been killed.
Right. So
you learn to appreciate life in a more real way, in almost a day-to-day, way. It also helped me become more of a role model. So when I would talk about resilience, I would talk about what happened to me, and it would help the people that I was talking to and helping them overcome things, that I could be a role model. And there was one case not too long after I was shot, maybe a year later, where there was a shooting at Bronx Lebanon Hospital here in New York, in the Bronx. And there was a resident that was shot in the hospital who was more seriously ill, and he was transferred to Mount Sinai. Mm-hmm. And I went to visit him.
I remember hearing about this. Yeah.
And I said to him, I may be the dean, but I'm your brother.
Right.
And I said, I can help you recover from your shotgun wounds.
So when we share a little bit more history, I was on the Road to Resilience podcast a while ago about my experience with gunshots and violence. I watched my sister get shot to death many years ago, about 22 years ago. And even though I wasn't personally shot, I watched it happen and I ran for my life. And so I know exactly what it's like to have PTSD, loud noises. Can you talk a little bit about what lingering PTSD you had after the event and maybe even still to this day? For example, if I hear a loud noise, I mean, I just have my startle reflex is not appropriate.
Yeah. So I didn't develop diagnosable PTSD, but I had some symptoms.
Right.
For a long time, I didn't watch violent shows on TV.
Right.
And for a while, Even when I think about it now, really, I didn't go out that much. I went back to work 2 or 3 weeks after I was
Controllable
shot.
environment.
And I gave the white coat speech 2 or 3 weeks after I was shot. It was actually the best speech I think I ever gave. But my wife and I didn't go to restaurants, for a while. And like I said, I didn't watch, TV programs that were violent. And when there was violence in the news, it was a reminder.
Yeah.
Right. But then it turned into something positive. And, I began to think, I fully recovered physically, and now I'm a role model. It's made me a stronger person.
Right.
And it made me more able to help other people because I could talk about my own experience.
Yeah, only a truly resilient, optimistic person can look at something like that and say, this made me a better person.
It did.
Yeah.
In fact, 2 weeks ago, I know the fire commissioner of New York.
Mm-hmm.
In fact, because he was involved in providing security, for me after I got shot. And so now he's the commissioner. And he asked me to talk to the graduates of the academy in the fire department. And I went a couple weeks ago. First of all, it was amazing because I walked in with him and they all stood at attention.
Yeah.
You're
like, I like this. I should have, my faculty should do this.
But I was able to talk to these young men and women who were going to become firefighters and who were going to face trauma. That's just part of the job. And to talk to them about resilience and to tell them about my own personal experience.
Right.
I couldn't have done that if I hadn't been shot.
Yeah. So, I hate saying we're lucky, but I think you and I probably both had the tools in our toolbox to get through our own traumas.
Yeah.
There are a lot of people out there that don't, despite their best efforts, they don't have the tools in their toolbox and they need harder therapy or more medications. Now, you worked on ketamine for the treatment of depression and PTSD. Can you tell us a little bit about that?
Yeah. So the work on ketamine is mainly revolved around depression.
Mm-hmm.
So it's a part of the research I was doing for many years, and it actually started when I was at Yale. And the research that we were doing determined that the traditional antidepressants took a while to work.
Right.
And they worked through monoamines, serotonin and norepinephrine. And we felt that was not enough, that we needed to look for another mechanism by which people could get better from depression. And we and my colleague there is John Crystal, who I was his mentor, and now he's chairman of psychiatry at Yale. We're still close friends. We felt that it might involve another chemical system called glutamate. And there was a drug, ketamine, that affected the glutamate system. So we felt, maybe it might be antidepressant. So we had a bit of a theory there. And we did the first study with 7 or 8 patients where we gave ketamine or a placebo, and the patients got better in a few hours.
Was it an infusion?
It was an infusion,
mm-hmm.
Yeah. And it was like a miracle.
And how long did the treatment result last?
Well, the single dose, so there's only a single dose.
Right.
The single dose lasts between 2 to 3 days.
Okay.
But to see patients get better so quickly, it was like awakenings where Parkinson's patients got L-DOPA.
Right.
And we were experienced clinicians, so we knew this was real. But nobody believed it. They didn't believe in the mechanism of glutamate or that you can get better right away.
Also, ketamine scares people. It
scared people.
Yeah.
Back then it did.
Yeah.
So we published it. It kind of just sat there. Nobody tried to replicate it. And then I left Yale to go to the National Institute of Mental Health. And I said to the group there, we got to replicate it. So we replicated it. Then all hell broke loose with people replicating it. And ultimately we patented it. And it's now on the market as Spravato.
How often, let's say, if you can imagine how often ketamine should be used, what percentage is it actually used now? Is it still underused?
I don't know if it's underused, but I know its use is being dramatically increased. because people are becoming more comfortable with it. It works for treatment-resistant depression, which is common.
Mm-hmm.
And it got approved as a monotherapy. So it's going to be used even more.
What's the regimen that they recommend for that?
So it's intranasal, and so it's convenient, and you take it twice a week. So you don't have to take it every day.
That's great.
You take it twice a week for at least, say, 4 to 6 weeks, although you're going to get better in the first week.
Right.
And then the doctor will determine you still need to take it twice a week, or maybe you only need to take it once a week or every other week. So it's different than other treatments where you have to take pills every day.
And are most providers, is this readily available to people getting to the right psychiatrists?
You have to get to the right psychiatrist who has to be experienced in monitoring the effects of ketamine. But it's now much more available.
That's amazing.
Yeah.
Do you think we're ever going to get to a cure where there's something that maybe 1 or 2 treatments and then someone's cured and doesn't require any more treatments?
In depression?
Yeah.
I mean, it's possible. Ketamine is not a cure. That it's not like you take it once and you're done, you're better.
Mm-hmm.
So we're not there yet. But going from antidepressants that take weeks to months to a treatment like ketamine that works right away.
And side effects. A lot of side effects, a lot of the medications.
Yeah. But the advance of the treatment taking a long time to people getting it better in a few hours, that means we're getting closer.
Right.
To maybe come up with a treatment that might be curative. But we're not there now.
Are treatments like deep brain stimulation for depression or ECT, are those curable or, again, just kind of Band-Aids?
Band-Aid is not the right word.
Okay.
Because depression is a serious disease. As you know, suicide can happen. So these are real treatments. It's like, in a way, diabetes.
Right.
Right? So in many cases, it can be chronic, but some people only have first episodes of depression, and then you treat them, and they stay well.
Mm-hmm.
So the treatments are pretty good. ECT is for people with more serious depression. It turns out that ketamine is as good as ECT or better. So now patients that would normally go to ECT are getting ketamine.
Right.
First. The same with deep brain stimulation. That's a more aggressive treatment for people who have not responded to other things.
Right. My father suffered from debilitating depression most of his life. And many years ago, when he went through treatment of prostate cancer and needed radiation and suffered a lot of the complications, it triggered another pretty severe depressive episode. And so many pills, nothing was working. And he did very well. It's been now 10 years since successful ECT for him. He went through
ACT
multiple
can
rounds,
really work.
Changed his life.
That's great. Because it can really make a difference.
I will say, but even being in healthcare, for me in healthcare, I heard ECT and I got nervous. Why are we still doing this? That seems so old age, but it's not. It works quite well.
It works quite well and it's safe.
Yeah. Let's talk for a minute about the killing of Brian Thompson, the CEO of United Healthcare, which took place on December 4th here in New York. I can draw some parallels with what happened to you. From what you know, as a leader of a healthcare institution and yourself being a victim, what are your thoughts on this incident?
It's becoming more common.
Yeah.
That it's become more common that physicians are being attacked, even within hospital settings. And so when I heard that, I in a way, I wasn't surprised.
Right. Which is awful to feel that way, right?
It is, but more and more people who are in leadership positions, whether it's in, healthcare or politics.
Right.
President Trump was attacked twice. So if you make, decisions, that are publicly renowned or known, better yet, that you can be at risk and you got to be careful.
Yeah. And it's like you said, the buck stops with you. You didn't know this guy that shot you, but you signed off. And ultimately, it's like the buck has to stop with someone. So that's where people might put their anger.
That's right. Exactly.
So this is not surprising to you.
You got to be careful.
Yeah. Back to the healthcare providers that you work with. What do you think are the most coveted or important qualities in the healthcare providers that you work with?
Dedication to their patients, empathy in terms of what the patients are going through, patient needs to feel that you really care about them, and great skill. That a great physician, well, let's say physician, but of course it could be other clinicians, makes all the difference. If you have a serious disease, you could go to one place and get mediocre care and maybe you don't get better.
Right.
And you go to a great clinician, you could be cured.
Right. It's a big difference.
So you want to go to the best place. But empathy, in terms of personal characteristics, it's dedication and empathy are very important.
Right. Which goes back to what you said you think your strongest traits are.
Did I say that?
Yeah, at the beginning. What would you, from what you've seen, and you've been here for a while, what would you say are some of the common mistakes that healthcare providers make in their practice?
They get tired. They don't take care of themselves. In other words, don't pay attention to their own personal wellness.
Right.
So that could come through when they're treating patients, and that they're not feeling in an optimal fashion to take care of people. And obviously, they need to stay on top of advances in their field, because medicine, the discovery in medicine, different diseases, is at a very rapid pace now.
Yeah.
And so you can't rely on what you learned in med school to treat patients with the conditions you're expert in 10 years later. You got to really stay on top of things.
Yeah, I mean, being a healthcare provider these days is a sport. It's a sport. I mean, I have to sleep well, get exercise, be well fed and hydrated, or else how am I going to see 30 patients in a day,
Right.
go to the OR, and have enough empathy to make phone calls at 5 o'clock for people who are mad that I didn't call them back at 10? It's exhausting. It can be very difficult.
And you got to stay on top of your field.
Yeah, and it is true. Okay, so truly taking care of yourself. So generally speaking, people coming into healthcare or starting to feel burnt out, really following the prescription for resilience, which hopefully we can put up at the bottom of this screen. We can put up the link to the prescription for resilience. Because I read through that and I feel, generally speaking, I'm really good at crossing off everything on that list, but it becomes really difficult by like noon on Friday to keep crossing everything on that list. You get tired.
You got tired.
You get tired at the end of a week.
You work out every day?
5 days a week.
Okay.
Today's a rest day. It's very hard for me to have a rest day. Rest days are the most difficult because I really just want to go to the gym.
Yeah. I take Monday off.
Monday's a good one. You work
because I exercise much more on the weekends.
Do you have longer, heavier lifts on the weekends?
Oh, now you're getting into my routine.
Kinda. Yeah. I mean, we're here.
I alternate. So I do lift heavy, and so I will generally alternate days in terms of lifting and cardio.
Do you do upper body, lower body, or do you do a split?
I view my cardio as kind of upper body, lower body.
Okay.
So my cardio is on the rowing machine, or now I have what's called an assault bike.
Yeah.
Which is really good. And then on the days I don't do that, I do a really heavy lifting on the upper body.
Yeah.
A bench press, chest press, rows. That's those sort of. And I have a heavy bag.
And do you work out at home or do you go to a gym?
For many years, as you may know, I worked out here with the students.
Right.
And I love that. But then the pandemic hit. And in the beginning of the pandemic, I don't know what you did, but what I did is before I built the gym in my house, which I have now, I did the stairs.
Yeah.
So I walked up the 25 flights 3 times before my house had a gym. And so now I have a gym.
Yeah. I did like push-ups and lunges and burpees, and I hated every second of it. I just wanted like metal to push.
Yeah. So the gym I have in my house, I got everything.
And do you like working out by yourself, not having anyone around, or do you like kind of having the socialization and chatting with people at the gym?
I like it better, socializing with other folks. That's why I love being in the student gym. But in terms of time,
right?
I work when I work out when I come home, so I can go right downstairs and get it done. So it's more convenient.
Yeah.
And then on the weekends, I kayak with my son. So we're outdoors and we're together. We're buddies.
That's nice. That's lovely. Well, you were just talking about time. So your tenure is somewhat coming to an end here as the longest serving dean here at the School of Medicine. Looking back, is there anything you wish you would have done differently?
I mean, I wouldn't say major things. The major decisions that I made generally worked out in terms of forming research institutes and changing the curriculum for our med students and so forth. But there's always little mistakes. Like sometimes I didn't always recruit the right person,
Right.
and that sort of thing. But it's been a great run. It's going to be difficult stepping down.
What advice could you offer folks who are considering or actively pursuing a career in medicine, particularly psychiatry and research?
I have no regrets. I graduated med school in 1977, and it never had a regret. It's such a great field to be a physician, whether you're primarily treating patients, which can be very rewarding.
Right.
I loved research, because I felt I could make discoveries that not only help one person at a time, but can help a large, number of patients. But either way, fine. So here's another little tidbit, So when people ask me, how do I decide that what to focus on, and I say, one, you got to be passionate about it.
Right.
You got to have fun doing it, and you got to be good at it. Now, if you're not good at it, don't choose it.
Yeah.
So I think if you follow those three things,
Yeah.
you're passionate, you have fun, and you're good at it. It'll work out.
Yeah. I think like following your gut, making decisions. A lot of people feel like they have to follow what somebody else tells them or their family, what maybe someone's telling them in their head, but really it has to be in your heart.
Yeah.
So what does the future hold for you with all this possibly newfound time?
Yeah. So, a lot of people say, well, I'm going to spend more time with my family. I spend a lot of time with my family now. So that's not the reason I decided to step down. I've been doing it for 18 years, and I felt that I wanted to leave at the top of my game. And so I feel I'm doing that. But now I got to figure out what I'm going to do.
Mm-hmm. Maybe you'll do leg day.
I can't exercise 8 hours a day. So I'm working on it. I'm going to still do my research with people I collaborate with here. I'm going to write another book on resilience.
That's great.
And I'm going to figure out how to have that be an extension of what I've already done.
That's amazing. What do you think your wife and family expects from you in your retirement?
One is don't bother them.
Yeah, don't annoy them because you're around more.
Yeah. No, it's my wife and I are very. She's the best. We've been together for 56 years, so us spending time together is going to be great. But their expectation is that I remain happy.
Yeah.
And passionate about what I'm doing. That's key to them.
Yeah, I think from what you said, you wanted to step down while you still felt you were at the top of your game. I think this was a surprise to everyone. They thought we had many more years with you in this position. So definitely, I think you did that. So I'm assuming when you leave here as dean, either whether you hand it off to somebody long term or someone interim, there's going to be quite a sign out, I'm sure. Mm-hmm. You've seen lots of changes over the years of what challenges are for medical students or medical schools. What do you see in the next 10 years as some of the biggest challenges for medical schools and medical students that you'll want the next dean to focus on?
I wouldn't necessarily see it as challenges. There's so many opportunities because discoveries are happening all the time. So the opportunity, well, in a way, a challenge and an opportunity. The rate of new knowledge is gotten faster. And so in training the next generation, both as medical students and residents,
right,
and make sure our physicians in general are staying up to date,
right,
that's the challenge. The opportunity is we're discovering great things. We're doing a lot better in taking care of cancer patients and heart disease and neurological and psychiatric diseases. So opportunities and challenges go together.
So going back to what you recommend for providers, which is, stay curious, stay educated, keep learning.
And luckily we have things like ChatGPT, smartphones. When I was training, we didn't have any of that.
We carried like giant books around in our pockets because I didn't have that either.
We had the Washington Manual.
Yeah. No, I mean, that's the issue is they're lucky these days, but there's also a lot more they have to learn. Like when you went to medical school and even when I went to PA school, there was no, like, we didn't talk about brain computer interface or artificial intelligence or even have apps. Like
Right.
that wasn't, so now then they have to, it's a lot to learn how to use all of that.
But that's can be fun,
Right.
and the ability to learn a lot more. That's where the opportunities are.
Right. Let's talk for a moment about failure. Looking back at your career or your personal life, what
Right.
would you say maybe was your biggest failure?
Okay, regarding my personal life, you're going to like this one.
Okay.
I still remember there was a game in high school. It was the situation you dream about. We were down by 1
Oh, no.
with like 15 seconds to go. The play was for me. I went up.
What position did you play?
I was the point guard.
Okay.
Okay, so I remember the move I made. I had a pretty clear shot, and at the key moment, I couldn't decide whether to bank it or swish it.
So you flubbed it.
I flubbed it,
Oh,
and we lost.
you always bank.
And for years, this is actually true. For years, I had the feeling that when it came to crunch time, not only in sports but in life, I wouldn't succeed. So it took a number of
Yeah.
times when I did make the last shot or succeed, in facing things, till I got to the point where I said, I am clutch.
Yeah.
But that was bad in my junior year, playing Oceanside. So that was big. I can still remember it today.
What about in your professional career?
So in professional, career, first I tell our faculty often that if you're not failing, you're not trying hard enough, particularly in research, that you need to push the envelope. And that's how you make great discoveries, through failure.
Right.
And in my case, the reason that we ultimately went to glutamate in the discovery of ketamine is because there were a lot of experiments when we were focusing on a different hypothesis that it failed. And by understanding that failure, we ultimately came to
Yeah.
a big success.
I like the phrase, you never lose, you either win or learn.
That's good.
Yeah. What do you see as kind of like the new frontier or a new niche in either research or medicine that you think is going to be really exciting over the next 10 years?
So I'll make this partially personal, but it also is a new frontier, and that's gene editing. That when you've determined through sequencing, genetic sequencing, which we can now do more routinely, you're going to identify genes that guide you in what treatment you ought to use. Hasn't happened much yet, but it's going to really happen routinely. And occasionally you'll find a person who has a genetic disorder that you can literally change the gene. You'll take out the bad gene and put in a good gene
Right.
in that particular area. And where it's personal is that 7 or 8 years ago, I lost a grandchild who had a single gene genetic disorder. Single gene. She was perfect in every way, except she had a gene which she didn't make surfactant,
Okay.
which is critical
Yep.
for lung function. So she only lived 4 months, but she was perfect in every other way. Now we're getting close through gene editing, gene therapy, that to take out that one single bad gene and replace it with a gene that makes surfactant, she would live perfectly normal life.
How many conditions are there like that where there's just like one gene is responsible for this major illness?
Enough,
Yeah.
I would say. Yeah.
And but the process is similar of kind of just like replacing that gene?
It's complicated, but it's becoming doable. It's all about how do you get the gene in, that process. But now we're with sickle cell.
Right.
We're able to cure sickle cell in terms of gene editing and thalassemia. So there are more and more conditions where we're going to be able to do that.
That's amazing. I did not know that. I'm learning that now.
Yeah.
Thank you so much for being here today. It was a pleasure spending time with you. I mean, I've listened to some of your interviews and gotten to know you through other people throughout the year. So I feel like this was a real privilege to spend this time with you. And hopefully everyone listening you can actually go online and search his name. There's incredible interviews that you can learn even more. Specifically, I think the interview that you did for the medical school, where you talked more about the prisoners of war in your teaching. So there's a lot more out there for you guys to learn about Dean Charney.